If the doctor detects any problems with your pet during an annual exam, you can rest assured that your pet is in good hands with the extended diagnostic capabilities of Ragland-Riley.
One of the most routine things that we do is blood work. In-house we do like a CBC, which is a complete blood count, where we measure red blood cell counts and white blood cell counts, to detect if the patient is anemic or if it is having any signs of infection or anything like that. The chemistry panel really looks at organ involvement. What we're checking there is like liver enzymes, kidney enzymes, also checks like blood sugar. Really looking for any metabolic problems with that.
Most of the time, results are ready within minutes, allowing the doctors to quickly address any health issues your pet may have while you wait. If the doctor finds any nodules or tumors present in your pet, Ragland-Riley is also equipped to take a biopsy and can diagnose cancers in-house as well. And that is just the beginning.
Another thing what we would do would be like a skin infection or ear infection. We would take a sample of that, look at it under the microscope and see what kind of infection we have. Is it a bacterial infection? Is it a yeast infection, so that we can treat it with appropriate medication?
Ragland-Riley Veterinary Clinic is also equipped with state-of-the-art digital X-ray and ultrasound imaging.
We have the digital radiography, which one of the nice advantages of it is we can take those and adjust the lightness and darkness so that we don't have to take as many X-rays to get the picture that we want. And it has a lot more definition than the older type, so that we can see things that a couple of years ago we could not see. One other nice thing that we have is the endoscope, which can be either a diagnostic tool or it can be used to treat things. The endoscope is, we use it occasionally, for dogs that have ate something they shouldn't have. Instead of doing surgery, we can actually go down through the esophagus and go into the stomach and remove it.
If the doctor finds that your pet requires surgery, Ragland-Riley offers a complete sterile operating room. The area of surgery covers a very large range of procedures from trauma to cancer. Dr. Ragland starts by focusing on elective surgeries.
That's talking about generally spays, neuters, declaws, things like that we're looking at in young dogs and cats for the most part. These are healthy animals that generally we're not trying to take care of a disease situation, but we're doing these elective surgeries to improve their quality of life and the quality of life that they have in an interaction with their owners. Okay? So a spay, neuter obviously are preventing reproduction, preventing some of the bad habits that can come along with hormones as those animals get older and grow up. And it also does decrease or eliminate the chance of certain diseases developing. Some of the more common diseases, say in older female dogs, are mammary tumors, breast cancer, as the #1 cancer outside of skin cancers that we see in older dogs, older female dogs. And being spayed at around this prepubertal age of 6 months or so of age virtually eliminates the breast cancer ever developing. Also, a common phenomenon in older female dogs is pyometra, or an endometriosis of the uterus, and obviously if they've been spayed at a young age, it eliminates that possibility. In older male dogs, one of the more common conditions is enlargement of the prostate gland. We don't see such a high incidence of prostate cancer like they do in humans as we get older, but in dogs, the benign prostatic hyperplasia is common, and being neutered at a young age will prevent that. So, those kind of things are important.
There are also surgeries that become more involved. Dr. Ragland and Dr. Waring have taken great interest in surgery. This, compiled with over 4 decades of combined experience, has allowed Ragland-Riley to offer a wide range of surgeries, with the exclusion of a few procedures left best to the hands of specialists.
You mentioned one of those, probably the more common would be like cataract removal. We do not do that service here. We think that's handled better in the hands of a specialist, so we refer those out. But trauma cases, orthopedic cases, fractures, growth deformities in young dogs that might require correction, angle corrections of the bones, things like that as they grow. Back surgeries for ruptured disc that can cause paralysis in dogs. All of those things we are able to provide. Fractures also covers a broad area, everything from simple fractures in young dogs that you might fix with a splint or a cast, up to much more involved type of fractures, from being run over by a car, hit gunshot fractures, which require all sorts of different fixation devices, internal pins, screws, external fixation devices, bone plates, etc. And we're able to provide all of those here on site. Surgery for cancer is also something that's very commonly done and can be quite involved at times and involve a lot of reconstructive surgery. So you not only have to remove the cancer, but you have to do it in such a way that you can get a pleasing functional and cosmetic result after that surgery. So it involves a lot of reconstructive, almost plastic surgery type of approach.
In order to perform advanced surgical procedures, all other services must be up to par in order to foster a safe surgical environment for your pet.
Surgery isn't a standalone item. You know, it involves anesthesia. It involves making sure you can do things safely and sterilely without infections developing. So you have to sort of ramp up all of the other services you offer if you're offering advanced surgical techniques. And so we get into advanced monitoring, where we monitor both with hands-on, in other words, a technician or nurse, or with a hands-on observation of that patient, as well as electronic monitoring, which monitors everything from blood pressure, the inspired oxygen levels, the oxygen saturation of the blood, the expired carbon dioxide levels, body temperature, EKG, and so on and so forth. Monitors all the parameters that you reasonably can monitor. And then from a sterility standpoint, there are different levels of aseptic approach depending on the procedure that you're doing, and the more advanced procedures require higher levels of aseptic technique. And so we're very conscious about their sterilization procedures, the procedures that go on in the surgery ward during surgeries. We use iodine impregnated artificial skins over the surgery sites where we need to, that type of thing. And by marrying all of that together, then you're able to get successful outcomes.
The merging of new technologies into surgery is allowing Ragland-Riley to take surgery to an even more precise level.
We're able to do that a lot through the use of the digital radiology that can be accessed in the surgery ward during surgeries, especially for orthopedic procedures. You can take your digital x-rays, you can monitor, or you can measure, different angles, and if you're doing corrective procedures or even getting fractures lined up correctly, if you're having to do corrective procedures for growth abnormalities in young dogs, you can do very precise measurements on how you need to cut and shift and change the bones around, that type of thing. So that's exciting. You can take the endoscopy and do a whole lot of that, not just from a diagnostic standpoint, but you can use the endoscope to get biopsies of procedures that used to you would have had to do surgical approaches like into the abdomen to get a biopsy of the stomach or intestine. Now you can do that using the endoscope, so it's a less invasive, much safer, much quicker, less expensive procedure. You can take like the surgical laser and merge that with the endoscopy of the ear to now remove ear tumors down deep in the ear, even behind the eardrum in the middle ear, by using the laser through the scope. Used to, you'd have had to do a very invasive procedure to have gotten rid of tumors in that area, and now you can do that just working through the scope.
Another area of technology that has found use in two areas of veterinary medicine is the use of lasers.
We've actually got two lasers in the practice. One is a surgical laser that we've had for several years, and one is a therapeutic laser, which is a newer acquisition for us. The surgical laser is really exciting. Like I said, we've used it several years, and it offers so many advantages to the patient. The surgical laser does, you can think of it sort of as a laser scalpel, so you don't have to use a metal scalpel blade. And it doesn't cut by burning tissue, which is sort of a common misconception, but it actually just cuts by vaporizing tissue. And so if you were here and watching it in use, as you're using the laser to cut, say, through the skin, you'll see a little, looks like smoke rise up, but all that, it's not really smoke, it's just water vapor as the cells are being vaporized. And as it cuts that way, it seals the nerve ending, seals the blood vessels. So what you see is a bloodless cut. It does almost no trauma to the surrounding skin. I mean, when used properly, I think the collateral damage, if you will, is like 1/10 of a millimeter next to your cut. So what that translates into for the patient is a less inflamed, less soreness, less pain associated with that surgery. And it's really neat to be able to do those surgeries and see these patients wake up the next day and there's no swelling around the surgery side. There's no pain when you palpate around it and all that. And so it offers a lot of advantages. Again, decreasing pain, decreasing blood loss, and so on and so forth.
The other way that you will find lasers being used at Ragland-Riley is therapeutically.
The therapeutic laser also can be merged with that to give really good, better pain control, better control of complications or prevention of complications. The therapeutic laser is not a cutting laser at all, but it just uses a different type of laser energy. It is primarily used to treat inflammation and pain, and that can be acute inflammation or chronic. It can be acute pain or chronic pain. And it's really amazing. You can take an area, say, of trauma, and using the therapeutic laser, it opens up, improves the circulation immediately. You can watch swelling just disappear right in front of your eyes as you're doing this. And so it helps nerve endings to heal. It helps cells to heal that have been damaged by inflammatory or traumatic processes. So indications are all, again, very wide-ranging. Covers everything from arthritis to sprains, strains, bruises, road rash from where animals may have been hit by a car and scooted along the road and like burned their skin, back injuries, neck injuries. So anything that's associated with chronic pain, acute pain, chronic inflammation, or acute inflammation are treated with a therapeutic laser. And the results are pretty amazing.